It's another day with the physicians where your health is our business. The growth spot will end. So they are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what
you're welcome back to the training also on your regular program.
Sleep health, they are almost, it's that circle of between unconsciousness and wakefulness. Let me just say it that way so that it's not too complex. Between unconsciousness and wakefulness.
Hepatitis is a general word used to describe the inflammation of the liver, which is a vital organ that processes nutrients, filters blood, and fights infections. Hepatitis is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be very fatal. When the liver is inflamed or damaged, its functions can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can actually cause hepatitis. There are 5 main strains of the hepatitis virus, referred to as types A, B, C, D, and E. While they all cause liver disease, they differ in important ways, including modes of transmission, severity of the illness, geographical distribution, and prevention methods. Some types of hepatitis are preventable through vaccination. A World Health Organization study found that an estimated 4.5 million premature deaths could be prevented in low and middle income countries by 2030 through vaccination, diagnostic tests, medicines, and education campaigns. On your regular program, The Physicians, we shall be talking on hepatitis, the risk factors, symptoms, diagnosis, and management. Stay tuned. Physicians, where your health is our business. Today we're discussing hepatitis, risk factors, symptoms, diagnosis, and management. My name is Dr. Martina Agbire, your regular anchor on this program. I have a guest who we actually have been trying to get to the studio. She's been very, very busy, but at least at the end of the day, we have her here. Very, very important guest, difficult to get. And her name is Dr. Duro Emmanuel. She is a member of the Society of Gastroenterology and Hepatology in Nigeria. She's a consultant gastroenterologist and hepatology from the General Hospital, IFAKO-IJAYE, Lagos State. You're welcome to our program.
Thank you, Dr. Martina.
Thank you for coming. Let me just welcome you first, because it's been for how many months trying to get you on the program. At least we don't usually rest until we get the people that we want on our program, the physicians.
I know.
Thank you so much.
Thank you.
So now I want to discuss hepatitis.
Yes.
Let's start with, you want to give us a general overview? What is hepatitis? Just give us a general overview. Where does it affect?
All right. Thank you, Dr. Martina, for getting me here and allowing me to do this. This is a special month for us. It's a month where we celebrate hepatitis in its entirety, especially viral hepatitis. Hepatitis, as the word goes, just means, I will try and break it down. I'm not going to use big words.
Better?
The big word will be inflammation. Okay. But I would say irritability. Okay. So irritation of the liver. Now, our liver is the biggest organ inside of us. The biggest organ outside is our skin. So inside of us, on the right upper side of our abdomen, this side, up here, is our liver. And our liver does a lot of work, over 100 functions daily. So it acts as a warehouse where they store things, and it acts as a factory where things are made. Now, different things can irritate the liver. It can go from excessive alcohol use, and that we call alcohol-induced hepatitis. You can have where your body itself is running against itself and irritating the liver. We call that autoimmune hepatitis. There are some drugs where the side effects or toxins, things that are not good for our bodies, tend to irritate the liver. We call that drug-induced hepatitis. Now, the one that we usually hear about is under the infections. Now, there are different kinds of infections that affect the liver. But the one that I will speak on is the one from viruses. Now, we all know, we've done biology, most of us, and we all know that there are some things we can't see with our naked eyes, and we've divided them into viruses, fungi, bacteria. Now, under the viruses, there are some that they love the liver. That is where they love to stay. So they call them hepatotrophic viruses. Now, these are the ones that we hear about. And these ones, there are 5. They're all in the same family, but they present the same way, but the way they are transmitted are different. So we have hepatitis A. They are labeled alphabetically. We have hepatitis A virus, hepatitis B virus, hepatitis C, D, and E. Now, there are other viruses that also irritate the liver. Things I will just give maybe 2 or 3. They are called CMV, cytomegalovirus. There is the HIV virus. There is the Epstein-Barr virus. They all do that. So this is an overview. So with the viral hepatitis, there are some that are, if I say curable, and there are some that are not. And the thing is, they are all manageable. They're all manageable. And the way they present, as I will go on, I would explain. But so most times you may even think it's malaria. But with time, when they do test, then it shows that, okay, this is what the problem is. Now, with hepatitis, it has affected, especially viral hepatitis, in our own space, country, Nigeria. You know, we are estimated to be about 170 to 200 million population. Population-wide? Total population. And for hepatitis, viral hepatitis, I'm specific about viral hepatitis. Okay. For viral hepatitis, we have about 1 in 8 persons having hepatitis B, and 1 in 20 to 30 persons having hepatitis C. All right. So it is quite a number of people. So if we say 1 in 8, if you say about 10% of the population, about 16 to 20 million people would have been exposed to the virus. Yes, that is quite high. And a lot of people don't even know that they have these infections until 1 or 2 tests, or there's a reason that will bring them to do the test when they come.
So you talked about the different types of hepatitis, the viral hepatitis.
Yes.
You talked about the A, the B, the C, the D, and the E. You want to just give us, tell us how the mode of transmission of the different ones. Then the presentation.
For A, it is usually what we call fecal-oral. That is contaminated food and drink. Maybe the virus has come where you go to places that are not as clean or hygienic.
Is the virus airborne?
Well, will we say it's airborne? No. We will say that it's through human contact. All right? So through human contact, not airborne. If it's airborne, you will have more
of respiratory
problems. So what you have for hepatitis A is usually fecal-oral route, meaning it gets contaminated, maybe the feces or something, and somebody touches someone's contaminated feces, or goes to toilet, doesn't clean well, goes to eat, things like that. So you have that. For hepatitis B...
So the carrier is always a human?
Yes. Yes. Then the B and C, these usually through blood transfusions, unprotected sexual intercourse, unsterilized sharp instruments, those that use hard drugs and intravenous drug use. Those are the main ways.
Okay, so from what you have just said, for the A that you talked about, which is fecal-oral, okay, that
B
one is from the gastrointestinal.
Yes.
Then it means that for the B has to be with the blood.
Yes, blood, semen.
Okay.
Blood, semen. Those are the major. It's in all our human fluids. That is saliva, breast milk, urine, stool. But the most effective way of transmission to another person is mainly blood and seminal fluid, semen.
How about C?
Same thing, same thing. But it is not as efficient as when we talk about efficiency, the risk of transmission to somebody else is not as high as in B, as in C.
So do you have like a familial history?
No. There's no familial history. But if a woman is infected with hepatitis B, there's a likelihood she can transmit that to her child during delivery. Because when she's pregnant, the baby is protected by the sac. You know, the baby is not just inside the womb like that. So it's inside the sac. So it's protected. So it's during the time of vaginal delivery, which of course there is blood during that time. So there could be an exchange from the mother to the child. That's the time of highest risk of transmission. So it is not a family heritage. It is not generational curse. It is that time. And even for children below the age of 10, they can get it if they have prolonged contact with someone who has had it, because their immune system hasn't developed fully. So if, like, I'll give an example. We're Africans. So if it's a male child, usually we say 8 days they go for circumcision. The circumcision done in the hospital is a sterile procedure, meaning that everything used for that child is sterile, that is devoid of any organism as much as possible, and is not going to be reused for another baby. But if it's a traditional circumcision, in the case of where, we don't want to go to the hospital, we just call a certain baba or a certain mama that does these things. We have them, and then they use their instruments. It's clean. I'm not saying it's not clean, but it is sterilized. And these are things that have been used for so many people. And someone who, a contaminated blood with hepatitis B is very difficult to eradicate, it's very difficult to remove, So it is during those processes when maybe that male child is being circumcised, there is bloodletting during circumcision. During tattooing or even traditional incisional marks, there is bloodletting during those things.
So we want to hear from you out there on hepatitis. Have you ever heard of hepatitis, which is inflammation of the liver? Let's keep a date with our physicians out there, keeping a date with the physicians. We'll be back after this short break. Stay tuned.
It's like an inflammatory of your liver.
I think hepatitis is a disease of the kidney and the heart.
Hepatitis is an infection caused by a virus that damages the liver.
I believe it's caused by different things, especially the excessive usage of drugs, wrong usage also, like drug abuse, and excessive intake of alcohol.
I think alcohol could cause hepatitis.
Hepatitis is either like through sexual intercourse or sharing of like sharp objects like needles or razor or toothbrushes, or contact with like someone's body or what do you call it, like body fluid or blood.
Through sexual intercourse, or I don't know. Yes, that's fine.
Like I just said, like through body contact, sex, kissing, and sharing of like sharp objects.
Honestly, I don't know. I don't know if it can be transmitted.
So now back to this, our discussion.
Yes.
Let's talk about the symptoms. First and foremost, is it possible for someone to have the hepatitis virus without knowing that he or she has the virus?
Yes.
So what are the symptoms? What are the presentations if you have it?
Okay, we can put them into 3 categories. 1, those that are asymptomatic, meaning that the person doesn't present with any symptoms at all. Most times, and I'll ascribe that to we're putting emphasis on viral hepatitis. With viral hepatitis, we are mentioning B and C. D, sometimes hepatitis D virus, sometimes coexists with B, or can be superimposed on B. All right. Okay. So it's like a partial virus, we say it. So it's like a younger twin of hepatitis B. Now E, sorry, because I didn't mention, is most likely seen in those who are pregnant women. And there, the mortality, the rate of which they could die is high. Now, going back to your question, as I said, 3 categories. So somebody can present without any symptoms. And you see that mostly with hepatitis B or C. In such cases, maybe they are coming to donate blood for one reason, any reason. Most times maybe husbands of wives that are doing antenatal care, or for different siblings coming, just pre-donation screening. So you can find those. They are all right, they are fine, but because they have to be screened, they are discovered to have this virus. It could be because of employment, pre-employment screening. It could be because of traveling. They want to travel out. It could even be because of insurance. So there will be a reason why they are asked to do this test. And most times they don't feel anything. There's nothing wrong with them. They just, go for this test, for the screening, and they are told, oh, you can't donate, or you can't get this job, or you can't, one reason or the other, and they are found to be either B or C positive. Now, for those who have symptoms, as I said in the beginning, the presentation of hepatitis from whatever cause is usually the same, in the sense that you may feel unwell at first, and headaches, general body pains, joint pains, and of course, in our own environment, the first thing you think about is malaria. So you may even treat yourself for malaria, and then you still find out after 3-4 days you're still not getting any better. And then you notice that, oh, maybe the eyes are getting yellow, or your abdomen, there's some form of discomfort, especially in the right upper side, or that your urine is getting darker than normal. Now, normal color of urine is yellow. It's not white. It is yellow, and it's not colorless. It is bright or light yellow to maybe amber or golden yellow. But when you start seeing it changing color, maybe darker or even to Coca-Cola, Coca-Cola. So, of course, that would get anybody worried. So the feeling of malaise, the headache, the joint pains, the eyes getting yellow, the person might not even notice the eyes get, might be somebody else saying,
like
your
jaundice?
eyes. Yeah, so that is jaundice, you know. So that will be like, what is happening, you know. So they will go to the hospital. And of course, even with all these symptoms, it could still be malaria. So the doctor checks and does some tests. We do malaria test, do the hepatitis B, hepatitis C test, and then if at that time it comes out positive, whether B or C, that at that period that person is having what you call an acute hepatitis B or C infection. Yes. So usually the cause of it is that your immune system should be able to fight it off. Remember, it is not a bacteria. It's bacteria we use antibiotics for. All right. So usually it should, you know, your body system, natural defense system should fight it off. And with time and, you know, rest, it will gradually go away. But there are some cases where the person is just too ill, and in such cases the person is admitted, maybe the person is vomiting, maybe this person is dehydrated. So you correct those imbalances and allow the person to have rest, and maybe, you know, in some cases you may reduce protein intake that they take, the food intake that they take, or give them a high carbohydrate intake, all in the bid of making the liver to recuperate.
Before you continue with the symptoms, you made a very important, valid point
of the protein.
Of the protein. Why would they reduce protein?
Because you want to reduce the load on the liver. You know, it's not all cases. So it depends on how the patient presents. So when you do that, then it gradually clears off. If you repeat the test months later, not immediately, when you repeat the test months later, it could read negative. All right. So most times, let's say 70 to 80%, those that have acute hepatitis B or C, the body will take care of it and it clears off. All right. So once they are found negative, then you can now say, okay, to prevent them further getting, you can now vaccinate them.
Okay.
All right. Then we get to those. The third aspect. Remember, we talked about asymptomatic. Yeah. We talked about the symptomatic. And now, those who come with complications. There are those who come, first time you see them, that means that the effects, the long-term side effects of whether hepatitis B or C on the liver is showing. And what are the complications of hepatitis B? Usually is in those who have had it for a long time. And what do we mean a long time? Usually we say irritation of the liver, persistent irritation of the liver by that virus for 6 months and above. Okay? So when let's just imagine a patient coming to me now and, oh, I just discovered that I did a test and I wanted to donate and they told me I'm hepatitis B positive. I can't know from you just saying that, unless you give me, maybe you give me an history, oh, and I did it 2 years ago, it was positive. Okay. And I've done it a year later, it's still positive. And I've done it last week, it's still positive. That kind of person is a chronic patient is a patient with chronic hepatitis B infection. All right? So that is that, because it's like, this is more than 6 months that you've had it persistently positive. Okay, so that kind of person could come with complications. Now the liver can undergo changes. Either it may not work at optimum, it was working at 100%, it will start working at 60, 70, 80%. Remember I said the liver is a factory, is a warehouse. Yeah. Okay, so it might not be doing the job it's supposed to do. It may totally fail. can have liver failure. All right? And it may also become the way it looks can change. We've all seen how cows, if some of us have seen when they slaughter cows out there, and you will notice that when they bring out the liver, it's one big pink, brownish, it's fluffy. So that is how it is. But it becomes darker, it becomes smaller, it becomes harder, it shrinks, and then becomes as if it has bumps on it. We call that cirrhosis. Okay?
But and of course, cancerous when you say it's cirrhosis?
No, it's not cancerous. It's just that. It's like I compare it to an untarred road.
Okay.
So you can't compare a smooth road and untarred road. You will move smoothly on a smooth road. On untarred road, you will just be, having bumps. But because of those bumps, blood and other nutrients will not be able to move properly in the liver. And as I said, it's a major organ. So you could have somebody having swelling of the legs, swelling of the abdomen because of fluid retention. You may have yellowness of the eyes, which is not going away, the jaundice. The person will start losing weight. The person will start, could also bleed, all right? Because in our liver, they produce protein that we call them clotting factors. There are things, when we have a cut now, if I have a cut on my hand, I expect that after a while it will stop because my liver is working. It's the liver that produces that protein that stops it from unless all my blood will just flow out. So you can imagine. Then there are vessels that could rupture because the liver is not working, because they produce new vessels. There are new vessels, and these new vessels are very, fragile. So they could start bleeding.
Thank you very much, Dr. Duro Emmanuel. Nice having you on our program, The Physicians. And trust me, I'll call you back again to come and tell us more, maybe on another very interesting topic that has to do with the gastrointestinal system.
Thank you.
So, as viewers out there, I'm sure you've heard all that she has said. We talked about hepatitis, which is an inflammation of the liver. On this, I want to say a very big thank you for being there with us always and watching our program, keeping a date with us. Remember to follow us on our social media platforms, on YouTube, on Instagram, on Facebook. And if you want to be part of this program, just go to our website, which is now very functional. Fill the form and we'll get back to you. Till next time, stay blessed. My name is Dr. Martina Agberian.